Hey there, do you have lower back pain and have you been told that you have a spondylolisthesis? Or do you suspect that you might have a spondylolisthesis? Now, this term, spondylolisthesis, is quite a tongue twister, as it's already done to mine. And it is a confusing thing to understand. It's a scary thing to be diagnosed with. And chances are, if you're watching this video and you've been looking up information about a spondylolisthesis, you've been told that you have one, or maybe a relative of yours got one, and your back's hurting because this is causing back pain, and you're concerned that you have one. I'm going to explain to you all about what a spondylolisthesis is, what's commonly done for treatment, and what natural alternatives there are out there to treat a spondylolisthesis and get successful long-term relief without having to have surgery, rely on medications, or have injections on a regular basis. My name is Dr. David Midoff, and I'm a specialist physical therapist. I have a company called Paso Manual Physical Therapy, and we help people get back to being healthy, active, and mobile without injections, surgery, or medications. We've been helping people out specifically with back pain that is a spondylolisthesis case, a known spondylolisthesis case, for years, and we've had an amazing success rate with these. Once we identify the problem and we look at all the mechanics, the way the muscles attach, the weaknesses in the individual, and we look at the global picture as well as the specific issues that are at each vertebrae and each joint, we've been able to come up with successful treatment plans to get that bone to shift back in the correct position, and of course keep that individual away from having to have a surgery, but also give them the confidence that they can go do the activities that they were doing before without making the problem worse in the future. But what I'm going to do through this video today is describe exactly what a spondylolisthesis is, in case you've never really looked it up or haven't found a great explanation on it. And then we're going to talk about treatment options, natural treatment options that are out there, so that you can begin to find relief for this problem and comfort, confidence as well, that you can fix this naturally without having to have a surgery. What a spondylolisthesis is, I got the spine here just to show you. You have the vertebrae here. The vertebrae are the bones of the spine. In the lower back, it's called the lumbar area, you've got 5, and the most common site where a spondylolisthesis happens is where the bottom vertebrae connects to the tailbone. There's a disc there, and what happens in a spondylolisthesis is that bone starts to slip forward. There's different grades is what they call it, which means intensities or severities of how far the bone is slipped forward. And the more severe it is, obviously, the more the disc is involved, the more nerves can get pinched. And in extreme cases, the bone on the backside can break or fracture. And that's usually a surgical situation right away. And you know it when you feel it. In case you're watching this video thinking, do I have a fracture? Typically the signs that people have are they're having bowel and bladder problems, which means they're having accidents, they're having lots of leg pain, inability to walk or extreme difficulty walking, and it's unrelenting pain. I mean, it's like they can't even sleep, they can't do normal activities, working or going to school, doing day-to-day activities, or you can't do it. You're going to go to the hospital very likely in that situation and go have a surgery to make sure that fracture's in position so that you're not having any long-term problems. But if you're not in those situations, thankfully, what is likely happening is that bone is shifting forward and your disc is getting aggravated, nerves are getting aggravated, and you're beginning to feel maybe some pain down the legs, but nothing that's stopping you completely from doing everything. And hopefully you haven't had any accidents that are more than normal if you're having accidents for whatever reason. When the trick here is to get that bone to come backwards. And oftentimes, if you're diagnosed with a spondylolisthesis, what happens, the experience that people have, is they're having back pain, it's hurting, they go to the doctor, a doctor will typically want to do x-rays whenever there's back pain because it's a normal thing to do, it's relatively cheap compared to an MRI, and you can get a lot of information from it. And when they do the x-ray, they'll be able to see right away that that bone is shifted forward, and they'll start talking about a spondylolisthesis. They'll be looking for the fracture, obviously, and they'll be looking to grade it, to tell you how severe it is. They might send you to physical therapy at that point, which is great. You got to make sure that you find a physical therapist that really understands all the muscle imbalances and the way to correct the movements and the strength in the area in a way that sets the bone backwards and into the position where it's supposed to be, so that they can allow the disc to heal, take pressures off the joints back here and the nerves, and allow you to heal for the long term so you're not having a surgery. Finding a physical therapist with that specialization is a little tricky at times. So what I recommend you do is interview the physical therapist's office, make sure that they've seen this kind of case and that they can help them naturally. Usually physical therapists that aren't familiar with spondylolisthesis cases they're aware of the diagnosis, but they'll have this response. They'll say, spondylolisthesis, or spondy is the nickname. They'll say, I don't want anything to do with that. You go see the surgeon. And that means that they're not confident or comfortable with handling that kind of case. So that's a clear indication. If you're out there interviewing physical therapy clinics for your treatment, that's a clear indication that you probably don't want to be at that clinic, because they're not going to know what to do with you. They're just not well versed in handling a case like that naturally. They defer to the surgeon. And if you're caught in that right now and you got sent back to the surgeon because your therapist doesn't want to deal with you, don't panic. And I would continue to interview physical therapists just to find one that you think will be able to help you out based on your conversation with them. Because what happens with the surgeon is sometimes the feedback that they'll get from the therapist is that it's more severe. The presentation that you had with the therapist or at the therapist's clinic is that it's more severe than the surgeon might have thought, and they're more likely to recommend surgery at that point because they want to help you out. They want to do good by you. And if there isn't a physical therapist out there that can help you, then they're going to think, well, it's not a therapy situation. Let's go ahead and do surgery. Hold your horses and get in surgery. Make sure you go find the right therapist first, is what I'm trying to communicate with you. Now, let's just, if you haven't seen a doctor for some reason, let's just go through how to feel if you've got a spondylolisthesis. And maybe if you've already been diagnosed with one, you can confirm this yourself. Now, let's look at the back of the spine. You see these bones right here and how they have this part that sticks out in the back that's called the spinous process. The way that this skeleton is shaped and positioned is normal. So you can see here that's the bottom vertebrae of the L5 bone right there. It's a little more backwards than the fourth one. What we find here with the people that have a spondylolisthesis is we'll find that this bone edge is right in line with L4, or even deep, too far deep. So when we go back here and feel it, you'll feel kind of a bump that shouldn't be there. And it's typically very tender on individuals. So if you just reach out to your back under your shirt and just feel all the bones there in the area, and if you feel one spot that's specifically tender and you feel like there's a bump in the area, chances are you've got a spondylolisthesis. Of course, if you're not a physician or as a physical therapist who knows how to diagnose this kind of stuff, all you have right now is a suspicion. You want to go get checked out if you haven't been yet and get it diagnosed via an x-ray, or some people want to get an MRI too. That's fine. You can usually diagnose it via MRI as well. Another telltale sign that you've got a spondylolisthesis is because there's popping sensations in your back. Now, this is a weird thing, but if you have it, you'll know it. It typically happens when getting up out of bed. Like if you do a sit-up type motion to get up out of bed, people will often feel like a click or a shift or a pop, and it'll happen in their lower back or in their pelvis area because that joint is pretty low in the lower back. Another time people report feeling it is when they're doing exercises, specifically like sit-up type exercises, abdominal exercises, and the worst is the ones where you pick up your legs, like doing leg lifts. So if you're flat on your back and then you go to pick up your legs from there to work out your abdominals, that can often create like a popping or clicking sensation. Sometimes it's not even painful. A lot of times it's not painful, but what it's a sign of is that there's an instability there in the lower back because that bone is shifting forward and you're just shifting it even further forward. So you want to avoid doing those types of exercises that create that popping or clicking sensation. So if you're thinking, well, what do I do? If I don't want surgery, I want to treat this naturally. What treatment options are out there? Where should I start? If I'm at home, what do I begin to do? One thing that you can do that will cause an immediate amount of stability and support to come to this area is to use a brace, like a lumbar support or a back brace, which you can get fairly reasonably priced at any sporting goods store or a department store. You can order those online. And you'll have to brace yourself up pretty good, and that usually gives yourself some relief because it takes pressure off the bones and doesn't allow it to shift so much. Just know that that's a short-term solution. That's not going to solve the problem for the long term. You've got to get your muscles right within your body so that you can pull that bone into the right position and allow it to heal. The discs, the ligaments, all the other tissues that attach to that bone that's shifted forward needs to heal. The brace is a great substitute for taking pain medication. Now, about pain medication, I'm not a physician. I can't give you recommendations on how to take pain medication exactly, but I have had patients that say that I put the brace on and I feel like I don't need ibuprofen for the day. Cool, that saves your liver and your kidneys and other things, and it affects your stomach. So the back brace might be a great alternative if you feel like that works for you. The second most important thing to do is to avoid exercises and movements that reproduce your back pain and that make that clicking noise happen, that clicking sensation happen. Because that sensation may not be painful, but you don't want, it's kind of a party trick for some people. They'll even be able to pick up their leg a certain way and say, look, can you feel that? Click, click, click. And it doesn't really hurt them, but if you're doing that, you're just repeatedly shifting that bone and working on making that disc looser and looser, and you're irritating tissues over time. Don't be doing that. Make sure you avoid that motion. If you find that getting up out of bed is always causing that clicking or popping sensation, avoid that too. Certain exercises or activities, like especially where you're bent over for a period of time, like gardening, doing certain chores around the house, you want to get help with those, or see if you can minimize your time there if it's something that needs to get done, so that you can protect your back from getting worse. And the final thing that I'll tell you that's really super important, it's kind of the beginning of what we teach here in the clinic, is learn how to fire your lower abdominals specifically. And I'm talking lower abdominals because if we flip this around here, if all of this is your abdominal space right here, at about the midpoint in your abs is where your belly button should be. So when muscles tension up at that level, it generally tensions up the stability at L3, which is in the middle of the lumbar spine. So if you go into the lower abdominals down by the pubic bone, if you tension up that area better, you will begin to shift these bones in the right direction. Now, just a side note here, we have a program called the 28-Day Back Health and Wellness Boost Program that teaches you exactly how to fire these lower abdominals very, very well. It's a 28-day program. It's all online. You can do this at your own pace. But if you watch the videos, learn, it's me teaching you how to fire your abdominals as well as progress through a back pain issue so that you can solve it for the long term. We have other exercises, a slew of exercises. It's what we teach our clients here in the clinic that are having this kind of problem. It's all the exercises in a progression so that this issue can be resolved naturally without surgery. Now, we show you on the exercises in that 28-day back health and wellness boost program how to modify them so that if you're real severe in your back issue right now, you can make them a little less intense so it's not flaring things up. And then also, if you're feeling that clicking sensation happen, you can begin to do the exercises in a way that reduces the clicking sensation. So it's all modifiable. And at the same rate, on the other end, you can, if you're feeling better, you're not irritated, the clicking's reducing or gone, you can use these exercises to make sure that you're stabilizing things further, because you can up the intensity on them and you can protect yourself from having this problem return in the future so that you can successfully avoid surgery, injections, and medications for the long term. So I hope that you learned a few things from me today. If you've got a spondylolisthesis, hope is not lost. You're not destined to have a surgery. Just be careful with how you move. Like I said, avoid the clicking. Begin to form a plan to get your abdominals more strong, especially the lower abdominals. And if you're looking for a structured program, I highly recommend you go to the description in our video here to find the link to get more information on the 28-day back health and wellness boost program to show you exactly how to fire the right muscles and begin to solve a back pain problem for the long term. If you thought this video was helpful for you, please hit the like button right here. And if you want to get notified whenever we release helpful new tips for your health to avoid surgery, injections, and medications and get back to doing the things that you love, please subscribe so that you can get notified all the time whenever we release helpful information. I hope that you have a wonderful day. Bye-bye.